Hi, welcome to the session. In this, we are going to look into the topic cholesterol explained. What is cholesterol? Cholesterol in human body is essentially a waxy fat-like substance that's found in typically the cells of your body, and liver produces this cholesterol. Your body needs to have some of the cholesterol so as to make the hormones, vitamin D, and substances that help you the digestion of the food you eat. Cholesterol is also found in the foods from the animal sources, for example, the egg yolks, meat, and cheese, and of course, other products as well. If you have too much of cholesterol in your body, then obviously it's an issue that needs to be addressed. When there is more cholesterol, it tends to form plaque within the blood, and this gets moved through the arteries. And over time, the plaque would stick to the walls of your arteries. And this building of plaque, the process is known as the atherosclerosis. And this atherosclerosis can lead potentially to coronary artery disease, where your coronary arteries become narrower or even blocked. That's where it results in potential stroke. Let's understand what are HDLs is high density lipoproteins, and LDL stands for low density lipoproteins, and of course you have VLDL as well. Let's understand each one of these elements and their contributions. HDL, LDL, and VLDL are essentially lipoproteins, and they are the combination of fat, which is lipid, and protein. The lipids to be detached from the proteins so that they can move through the blood. And different types of lipoproteins have different purposes. Let's understand these as well. The HDL stands, as we had just mentioned, the high density lipoprotein, and it is sometimes also referred often as good cholesterol because it carries the cholesterol to other parts of the body and drives it back to your liver. So the liver then removes the cholesterol from the body. So it's a what do you say, circulatory process, so as to ensure that there is a healthy supply of the good cholesterol, which is replicated in HDL. As far as LDL, as you know, it stands for low density lipoproteins, and sometimes it's referred as bad cholesterol because when there are higher levels of bad cholesterol, it could lead up to the building up of plaque in your coronary arteries. What is LDL or VLDL? So this is very low density lipoprotein, and some of the people also call this as VLDL or bad cholesterol because it essentially contributes to the building up of the plaque in the arteries as well. But VLDL to LDL, there are clear differentiators. VLDL mainly carries the triglycerides and LDL mainly carries the cholesterol. So that's one of the core differentiators. Now let's understand what are the causes for high cholesterol. So the VLDL also, as we have seen, is a contributor of the high cholesterol due to essentially unhealthy lifestyles. And what would this include? One, the unhealthy eating habits, such as eating lots of bad fat food, highly saturated food, for example, and one type of saturated fat that's found in the meat or dairy products to the baking products and the highly processed food. So it would be a good healthy choice of living practice to essentially discard some of these things that tend to produce very high levels and impact your body. Another type of trans fat is some of the fried and processed food as well. So you got to take a note of these things as well. Eating these fats can then raise your LDL or the bad cholesterol level. So this is a distinct advantage that you got to factor in and assess on the choice of foods that you are putting into your body. The lack of physical activity, this is one of the key elements as well. And with lots of sitting that you do and very little exercise, this would essentially lower your good cholesterol, that's the HDL level. So it is essential every day you have certain physical activity. At least ACSM, for example, prescribes to have about 35 minutes a day or about 150 minutes a week. And now let's look into smoking as well. So smoking also has the impact in terms of lowering the HDL, especially in women. It was observed in different studies. And it is also raising your LDL level also, which is not warranted. Now let's look into some of the main risks associated with high cholesterol. One, the variety of things that can change your risk of high cholesterol would include the age factor. Your cholesterol levels tend to rise as you get older. This is a very natural process that happens to most people. That's why the lifestyle choices, the physical activities are very important. So let's look into other aspects. So in the younger people, does that mean the plaque would not get formed? No, absolutely not, because you got to factor in again the lifestyle choices, including the exercises. Now, hereditary aspect, yes, some high cholesterol could run in the families. It's a observation, but lot of still validation needs to happen. Race, certain races may have an increased risk of high cholesterol. So we got to understand at the genetic profile as to what could be those potential influencers, and that's a separate item for discussion. And weight is another key factor, especially the overweight or obesity would tend to influence the body, and the cholesterol levels were very impacting it. So it's absolutely necessary to keep the weight in check and not to get into overweight or the obese type of scenarios, which would significantly raise the cholesterol level. So this should give you the perspective. Now, if you need more information on these topics, you could go to the websites and then get the information. Thank you very much for your attention and look forward to see you again. Thank you.